Okay, I'm Claire Roberts. I'm the Assistant Director for Health Improvement with NHS, Ashton, Leigh and Wigan, part of the public health team here. And part of my remit is that I have a lead on developing programmes of activity which increase and improve public health capacity and capability across the local system.
Great, thank you.
I'm Lynn Calvert. I also work in public health with Clare. I'm a manager for health improvement in neighbourhoods, and I work on the implementation of a lot of the programmes for which Clare's the strategic lead.
We probably started activity under the umbrella of making health everyone's business around three years ago, possibly a little bit longer than that. And really that programme was about working with different organisations in different sectors, so local NHS organisations, local authority, voluntary community sector, other public sector organisations, to really develop their role in delivering health improvements across the local population. And then making every contact count really emerged as a specific programme within that. So making the most of the contacts that frontline staff within those organisations have with members of the public and using those as health promoting opportunities.
At the same time, we've got a new team of health improvement practitioners that I manage, and part of their role was to develop public health capacity within our partners, especially within the local authority, because we work on a geographical basis.
Right.
So that in the geographical areas we needed our partners to have an understanding of public health to enable us to work together on objectives that we identified.
The work that we were doing really developed organically, and we came across different programmes and different tools that could support us in implementing it, quite often in an ad hoc way.
Yep.
And I guess our introduction to the framework happened in a similar way. We were working with the National Support Team for Health Inequalities, and they introduced us to the framework as part of the work around health gain across the local health and social care economy. So that's where we were introduced to the framework, and I think when we came across that, we were quite pleased because it gave us some clarity around the approach that we could take, and I think really allowed us to work and to deliver making every contact count in a more systematic way and on the basis of competence rather than going down the route of very specific topic, specific work.
In terms of the framework, it's for the on-the-ground staff who are actually implementing this. It's been very much a tool that's helped them convey what we're trying to do in terms of moving away from topic specific and moving to some generic competencies, some generic principles that irrespective of the issue, the competence or the skill remains the same. And it's helped in that way because it's allowed us to sell the idea.
Where we've used the framework quite a bit is with our community provider. So Bridgewater NHS Community Trust are using the competency framework now to look at the role that their staff have in delivering and implementing making every contact count. And I think that's been useful in terms of the different levels of competencies that we're expecting staff to have. And in the past, I think where there was a focus on maybe topic-specific training, so we want all staff to be trained in brief intervention for smoking or brief intervention for alcohol. I think now what they're recognising is actually we're seeing that as a level 2 competence, and they're recognising, well, not all of our staff need to be trained to that level, but actually we do believe that all of our staff should at least have competency at level 1. So it's been helpful in understanding how they can deliver. Initially it seemed like a huge task. How are we going to skill the entire workforce up to deliver this? But actually it makes it seem more achievable really. And I think clarifies where parts of the workforce, for instance health trainers or more specialist staff like stop smoking advisors, actually fit into that competency framework as well. So I think it's helped within organisations like that to clarify the approach and the strategy in making every contact count locally.
We've started off using the Royal Society for Public Health Understanding Health Improvement Level 2 award. And when we started, it was part of the local area agreement that the population had quite low attainment in terms of numbers achieving level 2. So it wouldn't really have mattered if the award had been in mechanics or hairdressing.
Yeah.
The fact that it was level 2 was what actually sold it for us.
Yeah.
We started to understand fairly quickly that we have pockets within our communities, especially, that really didn't like the idea of an exam at all.
Yeah.
Had never done one and were frightened just at the thought of it.
Of course.
So we knew that we needed something that was less formal. So we looked to the existing self-care programmes that were out there, because obviously they're on public health topics as well, and found that they were a little too generic for what we wanted them for. So we wrote our own based on self-care principles, one for older people, one for younger people, and one for men. Mainly because what is self-care for someone at 16 is not the same thing as if you were 74.
Absolutely.
And that's worked quite well, and we're going to be expanding that and working with people with learning disabilities to do one for people with learning disabilities, and we'll be doing one specifically for women. We then started to look at it in the same way that we'd looked at the health training programme 3 years ago, in that we'd done an awful lot around knowledge, but where we were falling down was around skills. And this is where the competency framework really started to come in, because people knew what they needed to know.
Yeah.
What they weren't able to do comfortably and confidently was instigate what might be deemed to be a difficult conversation. So we then started looking around and brought in Essential Public Health from Stockport, adapted it slightly to fit in with our existing programme, so that we don't only have the nose out element, we've now got the shows out element as well. So we're not just giving them the knowledge, but we're now giving them the skills. And we've now developed hybrids of all of those.
Right.
So as Claire said earlier, it's developed very organically, which is brilliant.
Yeah.
But it's also quite messy and time consuming. But the fact that it developed in that way means that it's now selling itself. It's not something that we have to go and do.
I think, as Lynn said, we've done a lot focusing on what we've called winning the hearts and minds, so developing the converts to this. And I think we've done a good job of that, but there are still new areas that we want to develop into. I think Greater Manchester Police is another organisation that we're going to start working with within the next couple of months. I think our ambition is to develop a sustained programme, and we've obviously got the challenges now with the NHS reforms and the challenges that brings with it. So we're working at the moment on a business model with partner organisations to look at how we do that. But we also see the role of voluntary and community organisations in working alongside us to sustain the programme. We've already done it within certain sectors, haven't we? So again, the community trust have bought into the notion of making every contact count, and are cascading the training and cascading those messages themselves. You know, that programme now is self-sustaining within that organisation, and I guess that's what we want to see across the system.
We've been, I think, quite successful in getting non-NHS organisations to buy into this. And the way that we've started to do that is by talking to them and making friends with them and doing the winning the hearts and minds element by saying, what is it within your objectives that's also within our objectives? So how can we work together to be more efficient and save some money? And that approach has sort of started them looking at us in a different way, I think, because some were flexible, responsive, and we can work with them to help them achieve their goals. It isn't just about us saying, Emma, we'd like you all to do brief intervention on smoking or weight management or physical activity or alcohol. It is about identifying where's the common purpose and how can we work together. And now that we've developed that reputation, I think what I would like to see is more and more people knocking on our door and asking us to work with them.